that, just want to say welcome once again. You know, it was a year ago, approximately 1 year ago, that we learned about the coronavirus and it began to impact our country. If you think back a year ago, we knew so little about this virus and you know how it was spread and all the impacts and so forth. So we've learned a lot in a year. We've now got a vaccine, a number of vaccines, viable vaccines available today, and the supplies are going to ramp up. And you know, but I know there's a lot of questions. And so I've asked Dr. Alonso, who is the director of the Florida Department of Health, to join us and answer these questions. And I can't thank you enough, Dr. Alonso, for your generosity of your time and you know helping us all understand what's happening. With that, if you would like to say a few words, and then we can start this conversation.
Absolutely. Thank you very much for having me. It's my pleasure, and that's what I do, because that's how I like to help my community. And I love talking to the public so they can understand and give them the facts. I think you have heard a lot about the numbers. We're very proud of the fact that we have vaccinated 59% of our population over the age of 65. We actually have been since the very beginning looking at our minority communities and our minority areas and our underserved population. At this time, we have been able to look at the population that is at the age of 65. That number for folks 65 and over is 346,044. That is from the 2019 census. And the reason we're continuing to use that data is so that the number is consistent. We don't want to change the population with the growth and then misinterpret the number. So we're sticking with that 2019 census. With that is that number as of the 23rd, that we have vaccinated 204,999. So 204,999 is 59% of the over 65 population. In our Black population, the over 65 and over is 30,874. We have vaccinated 9,976. That's 32% of our Black population over the age of 65. And for the Hispanics, we have our census data is 39,314. We have vaccinated 11,260. So therefore, our percent of the population of the Hispanics vaccinated is 28%. So as you can see, we have on purpose since day one try to distribute this in a way and gone out to locations where we're serving not only the places that the governor has chosen, like the big sites like Century Village and Kings Point, but we've also targeted on purpose underserved areas where people cannot get to drive around and get to locations. So we're very proud of that, and we want to be able to get all the information out so that people can make informed decisions as to whether they want to sign up for the vaccine and allow them to go to the locations nearest them. Right now, we have got, in addition to the Publix, we now have a CVS that Publix does not exist out in the Glades. So they have set up a federal site with vaccine coming from the feds at the CVS out in Belle Glade. So Belle Glade right now has 3 sites where they can go to: the CVS, the Pahokee site at the stadium, and the health department clinic right off of State Road 84. They can go there also. That's by appointments. CVS will be by appointments, and the Pahokee is drive up with no appointments to make it easier for those people who cannot navigate the appointment system. The appointments for the Belle Glade Health Center, that's the C.L. Brumback Health Center, which is our health department site. That is, you just have to call the health center out there in Belglade, which to make your appointment. So we have done this, and the healthcare district, in addition to the Publix, has set up a site in 3 locations, one on the south end at the South County Civic Center, the other on the north end at the Burns Road Community Center in Palm Beach Gardens, and then of course the one that's further out west that will serve the center of the county as well as the western part of the county at the fairgrounds. And that is the mass vaccination site, where once we start getting enough vaccine, we could see up to 7,000 patients per day. So we're ready and set up to be able to do mass vaccinations. We of course encourage and continue to ask for more vaccine coming into Palm Beach County, and more federal vaccine coming into the county, so they don't take it away from our allocation. So I think we've been squeaking a lot so that they pay attention to us, and with the help of the county commissioners who have been so supportive in this, we could not have been doing this alone. Okay, there's no way that a health department can take care of this kind of massive effort all by themselves. We always depend on our community partners, and that's been a long tradition here in Palm Beach County. We're very fortunate to have commissioners like Commissioner Weiss, who've just been outstanding, our county administrator, our county mayor, and everybody's been very supportive. And of course, we have the advantage of having the taxing district, the healthcare district, to be a partner along with us, which is why we created them back in the 80s, to be able to do this kind of work. So I think we have a very good system here in Palm Beach County, and I'm very proud of it. And so I'd just like to open it up so we can start having questions, and I think that's what the public wants to hear.
Okay, great. Well, thank you so much. And starting off with some questions, and we received a number of questions regarding the vaccine itself, and then some in regards to, how we how it's being prioritized. So can you talk a little bit about, the question is really, we have folks that are homebound, that can't get out. We have, essential workers, postal employees, people in the grocery stores, police officers, teachers. When are those people going to be eligible to get their vaccines, and how is that going to be done?
The one that determines the categories is the governor. So the governor, by executive order, decides. The CDC makes recommendations, but the governors on each state are the ones that decide what they choose. So Florida decided to choose over 65 and over as the targeted population, first responders and healthcare workers. And the healthcare workers are individuals who are in direct patient care, who are actually taking care of patients. So if you're a doctor and you don't go to the clinic or you don't see patients, you're not considered a healthcare worker in the sense that you're not in direct patient care. So that's how that works out. And that is based on the executive order done by the governor. In addition to those groups, the hospitals also have the discretion to go ahead and vaccinate those individuals who have comorbidities. And so many of the, when you look at the statistics and you look at the data, there are people from the age 16 and up who are under 65 that have been vaccinated. Those have been vaccinated through the hospitals. They're the only ones that have that power. So after they gave the vaccine to the hospitals, Jupiter Medical Center right now has a website. If you go at jupitermed.com, I believe is their webpage. Just put in Jupiter Medical Center and the website will come up. And you, on the upper right-hand corner, there is some little lines. You drop down that menu and you go to COVID vaccine. And in it, it will tell you exactly what your doctor has to do in order to write a prescription and a letter to Jupiter Medical Center. They look at it. If it fits the criteria, then they will call you for an appointment. It has to be done with your medical doctor. And the criteria is spelled out there exactly who qualifies for these comorbidities to get vaccinated. So that's the method that is utilized, and those are the very strict groups. So the governor is thinking now of extending it to 55 and over for teachers and law enforcement. That has not happened yet. He has to change the executive order in order to be in compliance with his own executive order. And right now, he's just suggesting that at the federal sites. And he was in Miami when he gave that statement. So it's going to take some time before those other groups get added to the executive order from the governor.
Okay. We received a couple of questions about the protocols if you're getting other vaccines, like the flu vaccine, regular flu, or shingles, or the pneumonia vaccine. What happens? And then what are you able to get the COVID vaccine? And if so, how long in between them? And what happens if, in the case where you're in between doses? And I know we've had this happen where somebody got a pneumonia vaccine in between their first and second dose.
Okay, first, let's talk about the difference between the Pfizer and the Moderna. There's been a lot of questions about that in terms of the wait time. For Pfizer, it is 3 weeks. For Moderna, 4 weeks. The CDC made the statement that you could get up to 6 weeks that you would still be in the very safe zone. So if something happens and you can't get the vaccine, or you can't make the appointment, you're good up to 6 weeks. If you miss those 6 weeks, you still should go ahead and get the vaccine, because even if you go beyond that, you still want to get that second vaccine for it to work properly. The other issue is if you have, we have had some people who have gotten a shingles vaccine, for example. You're supposed to wait 6 weeks until you can get your COVID. So there's been a few people that have come up for their vaccine, and they got the first vaccine, they went ahead and got a shingles vaccine. Now they've got to wait to be able to get that second shot. And that's okay. We can accommodate you. We will accommodate you. Just let us know, and we will make arrangements for that to happen.
An interesting question we received identified that there in other countries, they ask in advance of the COVID vaccine whether or not you've had COVID. And does that matter if somebody has had COVID prior? And if so, is there a time limit between when they were, I guess, cleared from being active to when they're eligible to receive the vaccine?
Yes, you should be asymptomatic before you go ahead and get the vaccine. There are some studies in other countries and some physicians that have done some studies to say that you don't need to get the second vaccine. But according to the CDC, at this point in time, they're recommending that you still get the 2 vaccines. It makes sense that if you've had it, that this second booster would serve as that, just one vaccine would serve as that booster to make sure that your immunity stays going for at least a year, which is what we hope. Is this will probably be a yearly vaccine that you have to get, just like the other flu vaccine. But that is still, being looked at. We don't know everything there is to know about the COVID vaccine yet, because if you understand that it's still in the phase where we are looking at millions of people across the world getting this vaccine to determine how long is immunity going to last, how is everybody going to react to it. All these things are going to take several years before that information is actually gathered to make that determination. What we know for sure now is that the vaccine will guarantee you 95% that you're not going to have to go to the hospital, and that you're not going to die if you have the vaccine, but you could still get COVID. Okay, even in, 95% means you have 5% that you won't get covered, right? So you do have the guarantee that you're not going to go to the hospital, you're not going to die from COVID. So I think that is, in my opinion, I certainly went out and got the vaccine as soon as I made sure all my other doctors got their vaccine first that are lined up in terms of vaccinating. But it's very important that you realize that. That's why we're still saying you still have to wear your mask. You still have to be careful, and you can't just go crazy because you get the vaccine and start, taking off everything and just running around and blowing caution to the wind. We still have a long way to go before we have herd immunity. That's when we can start relaxing. And that has to be 70% of the population. We're nowhere near getting to that number.
Right. And I think that, that brings up because we had a number of questions about, the continuation of wearing masks and why that's important. I think, in one of the meetings that we had and you and I discussed the fact that what we don't know yet is whether or not the vaccine keeps people from actually still being able to carry the virus but just don't get sick from it. But they still may be able to carry it and spread it to others. The research hasn't had enough time to figure out whether or not that's the case. Is that still true?
Yes.
So people can have it, have the vaccine, they may not carry any symptoms, but we don't know for certain whether or not they could actually carry it and spread it to somebody else. So that's why we still need to be careful.
Absolutely. It's very, very important. Palm Beach County has done such a good job maintaining their mask and maintaining the distance and washing and disinfecting. We've really done a really good job. We have been able to avoid the situations that you see in other states where they have had, massive deaths and had to get freezers to get people, California, these other very massive very dense populations have had a lot of trouble. We've been able to avoid that. I think for a lot of reasons, we don't have the massive concentration that we have in some of these other states, but I think it also has a lot to do with how vigilant we have been here and how receptive the public has been. So all of you listening in, I'm sure are the ones that do the right things and wear your mask and do what we're asking you to do. It really makes a difference. And we see it in our numbers. We see it in the hospitals being able to take care of the patients and not being overwhelmed and so forth. So we got to keep that up until we have that mass herd immunity.
What are the types of side effects people are experiencing from the vaccines?
The real serious side effect are for people who have to carry around an EpiPen with them. That's an epinephrine pen. Those are people that know that they have anaphylactic shock to different allergies that they may have. It might be peanuts, it might be bee stings. Those are the real serious ones. Most of the things that we have seen, at least so far here in Palm Beach County, are very mild. Either you faint, not because of the vaccine, but just probably because of the anxiety and the rush of finally getting that vaccine. Some people have been like so excited to get that vaccine that they end up fainting, and just very little side effects at the site itself. There have been some people that have had a mild reaction to the vaccine, anaphylactic shocks. Some have been taken to the hospital for observation. And one person died, but it does not seem to be related to the vaccine at all. I mean, we've had hundreds of thousands of people getting the vaccine, millions of people getting the vaccine across the world, and we have not seen people like dying from the vaccine. So they're very mild side effects, but everything in life has risk. So I'm not going to say that there is no risk to it. The way I look at it is it's just like driving on 95, whether or not you choose to drive on 95. The risk of the vaccine way outweigh the risk of getting COVID, especially if you have comorbidities or if you have any other compromising. The more risk factors you have, the more life-saving this vaccine will be. And in order for us to get out of this situation that we're in of wearing masks and being careful and not being able to travel, we have to get the world to have herd immunity so we can go on with life and go back to the new normal, whichever that will be. Um, just like we did in 2009 when we had H1N1. It was the same kind of thing. We were having to have precautions when we started teaching everybody to sneeze into their sleeve. The kids learned how to wash their hands. I remember going to schools and giving demonstrations on how the virus spreads by using the glow in the dark uh, lights that they would see, how everybody touches everyone in a room. And we did the same thing. We had, until we got the vaccine, 2 years after getting the vaccine, we finally had herd immunity, and the virus slowed down, and now we get our flu shot, and H1N1 is in the flu shot that we get every year. So
Interesting.
this
I
is
didn't
going to be
know
the
that.
same thing.
Number of questions. I don't know if you're going to be able to help answer these, but I think you probably have some insight. There are a number of questions about the difficulty in getting registered, whether it's through Publix, whether it's through the healthcare district. Now, of course, Walmart is coming online. Winn-Dixie, of course, neither one in Palm Beach County. Then, as you mentioned earlier, that CVS, and they're different systems, and people have to wait, and sometimes they get in, most of the time they don't. It's very frustrating. And then you also have people that are not computer literate, or maybe just not familiar with that technology, and they want to get vaccinated. They're over 65. When's it going to get easier?
Well, I must say that if I had the magic wand, that's the one thing that I would change. We live in a society right now that everything's on the internet, and the world has to wake up to the fact that especially our seniors and our underserved communities, there are many, many people that do not have access to the internet. There are many people that do not have computers. There are many people that don't even have cell phones. As hard as it is for especially the new generation to understand that. And so we have to have a system that you can try to get somebody to call or walk up and try to make an appointment. And so that is what we've tried to change. That's why we stopped our CHD feedback, because that was creating more problems. And so what has happened is that because you're going to have multiple sites, just like you have multiple sites to get vaccinated, to get tested, we're going to have multiple places that you're going to get vaccinated. I think the next group that will open will probably be doctors' offices, so that the doctors can start getting the vaccine that they want for their patients. And that's going to greatly reduce the frustration that people are having, because they expect their doctors to have gotten their vaccines by now. The way it was planned out was that the doctors that are in Florida Shot would all have the vaccine available to them, so that we wouldn't be having to vaccinate doctors' patients. And so that, I hope, will be the next group that opens up to get the vaccine, the doctor's offices, and more private pharmacies, like all the CVS's and all the Walgreens and Walmarts and all the other places, so people can go to multiple places without having this frustration. And the reason the frustration is so high, because in phase 1 of any vaccination production, you have very low limited number. And what happened here in Florida is that we picked a very large number of population to vaccinate, the over 65. If we had gone with maybe over 75, the amount of patients would have been much less, and we wouldn't have this backlog. So what happened is that the more sites we opened up for people to call, people signed up everywhere. People are signed up at 3 or 4 different places. So they signed up at Publix, they signed up with the healthcare district, they signed up with the health department, and they're waiting to get the first one that calls them for that appointment. So what we're finding is that only a third of that large list that we have, only a third are actual patients still waiting for vaccines. So the healthcare district now has opened up the link that you can go to and actually ask for an appointment. And we are getting ready to access our site at the Share Care site. And we're going to be, instead of letting them make the appointments themselves, we're going to be calling our patients for appointments.
So people may not understand what the Share Care site is. Can you explain who the Share Care site is?
Yes. The Share Care site is the state site that has appointments for not only Florida, but other states also. It's a company that basically sets up appointments.
Is that the My Vaccine? Is that the My Vaccine site up?
I'm gonna give that so everybody has it.
Okay.
That is where you go for your vaccinations if you want to get through the state. In other words, if you want to go to the health department, our site for the health department is Mid-County Senior Center. It's on Lake Worth Road. And the other site is out in Belle Glade at the clinic. So that site, that website is myvaccine.f as in Frank, L.gov. That's the site where you go to get a vaccine for the health department.
Okay, we'll put that in the chat.
Okay, and the telephone number, if you want to call instead of going online, is 866-201-6754. There's also a helpline if you want to ask questions at 833-540-2027. That's the helpline. And the healthcare district now has a website to go to any one of their different locations. They now, like I said, the Civic Center's down south, up north, Palm Beach Gardens, and then the one out at the fairgrounds. That site is vaccine, VACCINE dot H as in Harry, C as in Charlie, D as in David, P as in Peter, B as in boy, and C as in cat.org. And those initials stand for the Healthcare District Palm Beach County. So HCDPBC.org, vaccine.hcdpbc.org. And there's also have a telephone number. And I think they changed that telephone number.
If they changed it, if they've changed it, probably maybe we should wait and we can post it on our Facebook page and send it out to our email list rather than, I don't want any, people have been through enough. Yes. And I'd rather not.
The other side is the publix.com/COVID/vaccine. And that one's very frustrated. You got to get in early in the morning and sign up. However, I will tell you that Publix, up to the storm, when they stopped getting the vaccine because of the storm shipment stuff, they were seeing 19,000 vaccines per week. So 19,000 people were getting on Publix and getting vaccinated. So I don't want people to boo-hoo Publix, because they've been a great factor in getting a large portion of our population vaccinated. So I am thankful to have Publix on board. I am thankful to have as many pharmacies as possible. The more vaccine we get into Palm Beach County, the better.
So, I mean, and I know, this is frustrating because, there's multiple sites with multiple waiting lists, and, is this and I know that what you've told us is when we start to get into phase 2 and phase 3, the vaccine, as it becomes more readily available, and there's just, it will open up, and we're not going to have, quite this, but what I think I said on the dais the other day was that it's probably going to get a little more frustrating for people before, a little more challenging in that regard, because we're going to have all these disparate systems for people that are trying to navigate them all. And unfortunately, there's not just one place you can go and just put your name in and say, just call me. I'm willing to be patient. I want to, and just call me when my place in line is there. But unfortunately, people have to get into different lines or go on to some of these sites. And, you know, when they open up and whatever number of appointments they can give out. And, you know, we've seen, you know, the challenges. But as you said, I mean, 20,000 people per week almost from Publix are getting through there in Palm Beach County. So how is Palm Beach County doing compared to other parts of the state and or maybe even other states? Are we, you know, I understand, you know, that a lot of our people, you know, have gone to other counties to, you know, avail themselves of their process. And so, but as it relates to the percentage of our population, are we doing about the same? Are we a little further ahead? What's your opinion about that?
Well, I'm very proud. I'm glad you asked that because that's something very positive. We are way ahead of many, many states. And I will tell you that it's hard to compare states because the populations are different and everything, but we can compare in terms of the vaccination coverage in the 65 and older in terms of Florida State. Palm Beach County is number 1 in the metropolitan areas. And metropolitan means we have over 1 million people, right? So our population is 1.5 million. And Palm Beach County has, as of today, we're up to 59% of our population has been tested. That's huge.
Of our 65 and older.
Yes. And for Broward, they're in second place at 52 as of yesterday. Then comes Orange County 44, Dade 42, and Hillsborough is at 41%. That's over 1 million population. Now, obviously, in very small counties like let's say Gadsden, that only has 48,000 people, they're at 57%. But those little counties don't count. We got to look at the metropolitan counties, and we are number 1. So to be ahead of Miami and Broward is huge because remember, they started early. They have mass vaccinations being sponsored by the state, which we do not. That was not our choice. That was the governor's choice. And because we didn't have one, the healthcare district stepped up to the plate and said, we will do it. And so our mass vaccination site is the fairgrounds. Which I will say that having gone to Broward and having gone to Miami, I think the fairground beats them by a mile.
Well, we've gotten really good feedback from people who have been to the fairground site and they say how efficiently it is running. Just to go over, because I received an update from county staff, and you know what they talk about is. And unfortunately, Publix, because of the weather situation in the other parts of the country, the supplies were constrained even further and has not been able to open up. But my understanding is hopefully Friday, they'll get back to doing first doses. Everybody's been doing second doses though. So nobody who, you know, had their first dose and had a second dose scheduled has been held up because of that. But we have 67 public supermarkets. The healthcare district of Palm Beach County is operating the 3 primary locations, plus, as you said, their own clinics that they do. The Florida Health Department, you guys have the site over on Lake Worth Road. Pahokee High School out in the Glades, I think twice a week, they're opening up and vaccinating out there. Jupiter Medical Center, as you mentioned, now has received supplies for people with serious comorbidities, who are under 65, their doctors can make arrangements for them to be vaccinated there. The CBS in Belle Glade, which you mentioned. And then something I just heard about today is that we're going to be getting through the Department of Emergency Management and to help us with some of these equity situations is 12 HUD communities in Palm Beach County. They're going to be bringing and setting up points of distribution. And my understanding, they're going to be closed points of distribution to serve those specific HUD communities to target them.
Yes, and the advantage of that is going to be done by the strike teams being sent out by the state. So that vaccine is not going to come out of our designated allocations here in Palm Beach County. That's coming from the feds.
Is that similar to what happened with the churches when they came in
Yeah.
and did the churches?
Yes, and
And will they be doing that again, do you think?
yes, they're continuing to do that. As a matter of fact, there's going to be an interfaith at Bethel Temple. I don't know exactly where that's located, but that is a church event that's going to happen. They're calling those mini missions, and they're using the faith-based communities to help people come and because the churches are usually a place where people trust, and their rabbis, their pastors, their priests, whatever faith they have, that's usually a trusted place for many of the communities to get information and receive information to get the vaccine. So they're using those. And again, those are strike teams that come down from the state. They do everything so it doesn't interfere with our staff, and it doesn't interfere with the vaccine that we're getting at our sites to continue doing the vaccinations here. So we encourage, we're not upset, we encourage more vaccine to come to Palm Beach County, no matter how we get it, whether it's through strike teams or more pharmacies opening up. For us, the important thing is to get shots in the arm, and we welcome no matter how they get to Palm Beach County.
All right, you're probably not going to like me asking you this question, but I'm going to do it anyways. My 82-year-old husband got his first Moderna vaccine in New York before returning to Florida. His next dose is due mid-March. How do we deal with that?
You're going to have to send that. I would say send it to me through. If you sent it to Dr. Weiss, you just got. I'm sorry.
My mother's going to be really proud when she.
You're really a commissioner. You're not a doctor. I'm so sorry to talk to you that way. Give the name, and we've been helping with those types of situations because you definitely need to get your vaccine. We're asking people to go back to where they got them, but obviously we're not going to send you back to New York. That's just not going to happen. Okay. And we want you to get the vaccine. So we will make an exception. We'll get you in and we'll get your vaccine. I don't have Pfizer vaccine, so we will work with the healthcare district if someone needs a second dose of Pfizer vaccine. But we really, really encourage you. If you went to Okeechobee or you went down to Broward, your vaccine is sitting there for you in Broward. So please go back if you can do that, because we don't have the vaccine here. So we have to wait till we have an extra dose or Pfizer. With Moderna, it's not as important because I can squeeze another dose and I can, work with that. But with Pfizer, it's very specific and they're vaccinating on certain days. So if you got your vaccine at another place, please try to go back to where you got it from. They have the vaccine there for you. And if you don't go and cancel it, that means that vaccine is left over. And we don't want to have leftover vaccine.
No,
so somebody else will get it.
So, we have a number in District 2 and all throughout Palm Beach County. We have a number of over 55 senior communities. And are there going to be on-site distribution? Do you think that's going to be coming back? Or are they going to be able to send out the vans and so forth to do that the strike teams? And do you think that's going to be happening? And if so, when would that occur?
I think that for the over 65s, when there's enough vaccine, many of these places have organized themselves and they have even gotten providers that will be able to provide that for them. But there has to be more vaccine. We just don't have enough. The places that were selected by the governor, and they provided the vaccine for Kings Point and Century Village And so they came back and they revaccinated. So those were specific strike teams that were created to do that. And the governor did that to start off the 65 and over communities. As a matter of fact, that's where he started. He made his first announcement. We were there that day. I think they're ideal places to set up vaccinations because they have the clubhouses. It's a very ideal situation to give vaccinations, but the manpower that creates, and mostly woman power, I hate to say it's not manpower, but a lot of women power, to do that is tremendous. Whereas if you have a mass vaccination site like we have at the fairgrounds, those people can see 7,000 people in one day. And that's the ideal way. This mass vaccination is much more effective, much more productive, and involves less staff. So if you're looking at it from a convenience of the customer, yes, the HMOs, the HOAs, the locations make it very convenient at your own location. But for efficiency, the mass vaccination sites are the way to go. So it's a balance, like everything else in life. And I imagine that there will be more of that once there's more vaccine available.
And what about, and just as a follow on, the shut-ins, people that are not mobile? And, and I know we talked about, sending out the firefighters at some point and doing something like that. But when do you think that's going to happen?
That's going to happen shortly. Again, we're going to need a vaccine for that, but we also need to coordinate that because the definition of homebound is very elusive, sort of say. There's not a real sharp thing like 65 and over, we can have your driver's license, we can check it. But homebound means different things to different people. So one of the things that we're looking to do is to use home health agencies that are already going out to these people who are already taking care of these people, and perhaps give them the vaccine so that they can do that kind of vaccination. And we also used fire rescue to do testing for homebound folks, but the testing is very different. The testing, you swab your nose, you're done, you're out of there quickly. With this, you have to wait, you have to check, you have to do, this is a clinical operation. It's very different than just doing testing. So it's a little more complicated and involves a little bit more, I would say, expertise and a little more time consuming. So we have to, we're trying to make a good plan that will be able to cover everybody and do it right, and get all the glitches out. Interestingly enough, I was on a national call today, and we're really doing what the rest of the country is looking at. And many places, even Atlanta and some of the large places, have not finalized that yet. California, that has 500 million people, in Los Angeles, for example, they're doing fire rescue and home health agencies, exactly what we're thinking of. So I was very glad to hear that we're not too crazy in terms of our planning. It's pretty consistent with what the rest of the country is going to try to do.
And speaking, we talked a little bit about equity, and when we originally talked about, the vaccines and that it was going to be available to everybody, and now we have this situation where it's not a situation, but we require ID because of the age requirement. Is that going to go away at some point where people who may not have IDs but want to get the vaccine, is there going to be a point in time when they're going to be able to get it?
Not having an ID should not stop someone from being able to get it. There's many other ways to verify your age. And we can, if someone doesn't have an ID, you'd be
Do you have
happy.
a way to work with that?
Yes.
Okay.
Just like if you don't have a driver's license, or you don't have, for example, you can use a utility bill that is addressed, has your name and the address of where you live. For the age, there's other things that you can utilize that have your age. You could even get your doctor to give you a prescription with your date of birth, verifying your medical record. There's many other ways of doing that. What I would do is if you have that kind of a problem, send us an email, I mean, you're always calling the commissioner for everything and he very quickly sends it to me. So you can call and call us so that we can help you get the right things.
Okay.
Don't ever show up with, that's why we are so intent, the health department is so intent in calling people so we can get all those questions asked before we sign you up for the appointment. We don't want anybody to show up and then have a problem once they show up.
Okay. A couple of questions here specifically about COVID itself. Who is more likely to contact COVID, and where are they going to get it from?
Okay, right now, the age group that gets sick the most or that gets COVID the most is the 15 to 44-year-old age group. The ones who are dying from COVID are the 65 and over. So we are seeing a direct correlation right now with the deaths going down and the COVID vaccinations going up. I don't want to fully attribute that to the vaccine yet because our death rate had been going down from before. So I think eventually we definitely will be able to make that correlation. So the most likely people that 14 to 44, what are they doing? You know what they're doing. They're going out without a mask. They're partying. They're at bars. They're at restaurants. And that's where you get COVID, where you have large crowds, closed in spaces, and areas where people are on top of each other. For example, at a bar, reaching over the counter where you're 5 or 6 deep, you're getting your drink and you're drinking, your mask is off, usually hanging down below your chin, and you're drinking away and people are shouting, the music is going on, you're talking loud, and therefore you're transmitting the virus. And out of a group of 10 or 15 people, they go back and all 10 or 15 are positive a week away from their exposure, which is what we see, right? So that's the group that's doing it. In the schools, the children inside the classrooms are not getting COVID from other children in the classrooms. The kids that have been positive have come home with COVID. They've been contaminated, or the parents or the family or the relatives. Even teachers have gotten COVID outside of the school. So that's why the CDC made the statement that it wasn't necessary to vaccinate teachers before they opened schools. The schools needed to have all the precautions in place. And I must say the Palm Beach County School District has done a fantastic job in making the schools safe for the kids. However, we are in favor of teachers, especially those over 65, getting vaccinated. Like all people over 65 should get vaccinated, and especially those that have comorbidities and are over 65.
I will give I believe our board was helpful in once it was brought to our attention, the difficulties that some of these folks in the school district were having to advocate to get them a point of distribution, to get those folks that wanted and had not been vaccinated an opportunity to get vaccinated over 65. A question popped up and I saw it because you were talking about children. When are children going to be able to get a vaccine?
Well, there's nothing stopping a child from getting a vaccine now, but they haven't been tested, right? They haven't been in the study group. Like pregnant women have not been in the study group. Again, there's nothing to stop a pregnant woman from getting the vaccine. There's nothing that would have myself think that a pregnant woman shouldn't get the vaccine. As a matter of fact, I would encourage pregnant women to get the vaccine. But since they haven't been studied, it can't be recommended. Right now, there are trials going on with children, I believe, starting at the age of 12 and up. I might be a little off on that age, but So there are children being in the studies now, and I think that will very shortly be, that age will go down where younger kids will be able to get vaccinated. So that'll be a good thing for the kids to get vaccinated. I'm all for it.
Okay. And proof of vaccination. Are people going to have to prove that they've been vaccinated to travel, to go to, I mean, are employers going to be able to mandate vaccines? What do you think?
In the United States, we will never mandate vaccines. I don't think that's, I'm a public health person that believes deeply in vaccines. I don't want to get you thinking the wrong thing about me, but I don't think mandating something is useful. People need to make informed decisions and do what is best for them. I think we create a hostility when we mandate things, especially now that nobody, just think about yourself. The moment they tell you you have to do something, you don't want to do it. So to me, it's all about education. It's all about informing the public on the need for the vaccine and the usefulness of the vaccine, not mandating it. As far as travel, it is very possible that countries will want to see that, just like they're wanting to see testing and quarantining and so forth. So your little card that you get when you get vaccinated, people are laminating it, they're keeping it. You should have all the records of your vaccines, not just your COVID vaccine, but all your vaccines known. Your tetanus shot should be done every 10 years. So that's probably one that's really going to hurt you if you don't have it. Your flu vaccine, your pneumovax, and so forth. So all those are part of your medical record. Keep your medical records with you. They're very important. And this one, because of travel, I imagine is going to be very, very important.
I've been recommending people, if they have a smartphone, take a picture of it, keep it in their phone in case they lose that piece of paper.
That's where I have it.
Right. It's a simple way to create a record, and you can, if you need to, you can print it out again if need be. Just a couple more. We're closing in on 7:30 here. Again, this question about if you've had your vaccinations, why do you have to wear a mask?
Well, it's because of that 5%, right? Pfizer, Moderna are right around 94, 95% effective. That means you have a 5% chance of not. You play the lotto for a lot less chances than that, and you play it. So we want people to still be careful, and this is not a free-for-all. We also don't have herd immunity yet. So until we have herd immunity, the idea of being free to act as you want is really not a good idea. So
Okay.
it is possible that we may say, after your first vaccine, we might let things down, but we really have to continue, because that 5% is still real. And so you may be able to catch it. You're just not going to die from it. That's the importance of the vaccine. I got the vaccine, so I would not die from COVID. It would look pretty bad in the Palm Beach Post if Dr. Alonso dies from COVID, right? I can't let that happen. So I have to get my vaccine. But the mask is very important to continue doing that. We can't let our guard down here in the last, we see the light at the end of the tunnel. It's a long tunnel, but we can't let our guard down. We do not want a fourth wave. And some people are predicting that because they feel that everybody's going to let their guard down now with the vaccine. I am cautiously optimistic that we are past the worst of this pandemic and that we're on the way home to a new normal. So please make that happen. Tell everybody that's on this chat tonight to please continue to be vigilant. Don't let your guard down. We still have a long way to go.
Well, as we're beginning to wrap up, first off, I want to thank you so very much for your time and for all you've done for our community to help us through this very challenging, and for most of us, a really difficult time, things we've never experienced in our lives. And having public servants, because you really are a public servant like you, to help lead us out of this darkness and back into the light I can't tell you personally, and I think I speak on behalf of our community, how grateful we all are to have had you by our side as we go through this. I'm going to do a quick pitch. Number one, we're recording this, so hopefully we'll get it out. And if people missed parts or they want to see it, they'll be able to see it again. And also plan to do this again in a not too distant future. We were given an opportunity, I think, to work with, we have some great scientists over at Scripps that do a lot of work on vaccines and vaccine technology. And I think having an opportunity to talk to them as well, how understanding how the vaccine actually works and some of the myths about these vaccines, and that they're implanting things into your body, and to have them be able to talk about and to really help educate the people who may be a little more reluctant. And we'd love to have you join me for that conversation, because as we begin to open up and more people are able to have access to the vaccine, we want to make sure that we're able to get to that, as you said, you believe the 70% that we need to get to in order to keep our community safe. But it's been an honor and a privilege to have you join me this evening, and to be able to speak to so many folks throughout Palm Beach County and probably around the country to understand what's going on. And I really want to thank you. I want to thank all of you who have been watching this and listening to us tonight. And thank you. And everybody, I wish you all to be well, to be safe. And if there's anything anybody needs, please feel free, reach out to the office. We'll get you connected to where you need to go, or get the answers that you need for you. We're here to serve you.
Well, it is my utmost pleasure. There's nothing I'd rather be doing tonight than being with all of you. You have the best commissioner ever. I have to point this way. Commissioner Weiss has truly been a supporter of everything that we have done. Has been a great public health advocate. So thank you so much for your office and everyone that you take care of. So thank you.
My pleasure. All right, everybody, have a wonderful evening, and hope to see you again in the not too distant future in person, and being able to see everybody's beautiful faces.